So this is a video for Health One users on chronic disease management phase 2 in Health One. So I'll start by just briefly going through this PowerPoint presentation that I've created just to explain the different components of the new phase 2 chronic disease management. And the first thing is your requirements. So you need to make sure that you're using Health One version 8.9.0 or above. You need to, as before, you need a health link certificate for submission and you need a PCRS certificate for GMS validation. So they're just your requirements. So the first slide is, so what are the components to the Structured CDM Programme? So there are three components within the Structured CDM Programme. So the first one is Opportunistic Case Finding, or we call it OCF, the Annual Chronic Disease Management Prevention Programme, or PP, and the Structured Chronic Disease Treatment Programme, which is the CDM. So just to run through each of them briefly. So the opportunistic case finding. So an OCF review can take place every 5 years. The modified CDM, like the telephone or the video consultations, is not available within the OCF. And the purpose of this assessment is to identify those patients at a high risk of developing a cardiovascular disease and or diabetes. And the outcome of the assessment will be 1, low risk, and that means they'll stay in the OCF program. 2, they're high risk, and that means you'll register the patient in the prevention program. Or 3, diagnosis of a chronic disease, and that means you'll register the patient in CDM. And the age, so the age of it, so you would only do an opportunistic case finding in 2022 for patients over 65, but in 2023, where it will change to 45. So you'll be able to do them from 45 and above. And the PP is the same. It's 2022 patients 65 and above, and 2023 it'll be anybody over 45. So within the prevention program, so the component of this is patients registered in the prevention program will receive one scheduled review in a 12-month period. However, a PP review can take place every 9 months if required. And just to say, an OCF assessment must be submitted before you can move the patient to the prevention program. And we'll look at that now when we go into Health One. So you have to do, even if you're putting them straight into the prevention program, you must have an OCF done first. And that will make more sense when we look at it within Health One. So the outcome of the prevention program of the assessment will be 1, they're high risk, and that means they'll stay in the prevention program. Or 2, they have a diagnosis of a chronic disease, and that means you'll register the patient in CDM. And then the last one is the chronic disease management, the CDM, which is the one that you've all been doing up to now, I'm sure. So this really hasn't changed too much. There are a maximum of 2 reviews in a rolling 12-month period. The 12-month period is considered to be a rolling 12-month period from the date of the first review. There must be at least 4 months between all reviews. And the modified CDM or telephone review consultation is available within this at the moment. So you can still do a telephone or video consultation within the CDM component. And then the list of chronic diseases includes diabetes type 2, asthma, COPD, cardiovascular disease, heart failure, ischemic heart disease, etc. Non-telephone reviews, i.e. structured CDM reviews, will consist of 2 visits, one with the nurse, phlebotomist, and one with the doctor. And then the patient can only be enrolled in one treatment program at any point in time. So either OCF or chronic disease or PP, they're not going to be in 2 programs at the same time. So that's just a quick overview, a brief overview of what the kind of components of the new CDM are. Now we will have documentation when you're in Health One and you press F1. And this is just a sample of the document that will be in there. So it's a full user guide. It's also on the Clanwilliam website, but it'll give a breakdown of all the information that you need, and it's links to the HSC website and stuff. So if you need further information or clarification on anything there, you can go straight to the HSC website for that information. And as I say, that document will be available within the F1 help or on the website. So we'll open up Health One. And I have a couple of test patients ready here. So I'll open up my patient and I will begin a transaction or begin a consultation by adding a transaction and press OK. And as before, the same way you did a CDM previously, you will click on the little Mediforms icon to insert a form and you will search for your CDM Mediform. So you can see there it shows up CDM. If for some reason you didn't see CDM there, just click on your All Forms and it may be in there and you may just need to tick it on for it to appear in My Forms. So when I press OK, the first thing you'll notice that's new is this prompt box pops up first. And what this is doing is, beforehand it would have brought you straight into the chronic disease management, but now you can see here you have your opportunistic case finding. And you don't see your PP at this time, because obviously you have to do an opportunistic case finding before you can do a prevention planning review. So you'll have to do your OCF first, basically. But once the OCF is done, what we'll see in here then is the PP will show here, and then the chronic disease management. So to begin, we'll click on our opportunistic case finding, and it's telling me their patient must be over the age of 65 years. So let me just change that date of birth. And I press OK. And if we go back into our CDM, and we press CDM and we press OK, and we'll choose our opportunistic case finding and we press OK. And we can see here now, this is the opportunistic case finding review. So this is the first screen that pops up. So you can see here what it has done is it has looked into the administrative chapter and has pulled in the patient's GMS number, the patient's date of birth, their GMS doctor, the GMS number of the doctor, and the IMC number. So I will choose here their ethnicity, and I can type their error code. It's not a mandatory field. Just to say that you'll see anything that is a mandatory field will have the little red exclamation point beside it, meaning that you have to have something in that field before you can go any further. So we'll choose our White Irish. And this little icon here, this is a checker. So this will go off and check and see if the GMS number is valid. So if I click on this here, it's gone off to check the GMS, and you're familiar with that. I mean, you have that in Health One a long time. But you can see there the patient's name, but it's useful to check it at this point and see is the GMS number valid, because it won't submit if it's not. So you can see I have a valid GMS number. It's giving me all the information I need, and I press OK. So the indications for the review. So it's asking me for this opportunistic case finding, what are the indications? What are the reasons I'm doing this OCF in the first place? So could be that I've taken bloods on this patient, and something has come back, and I want to do an opportunistic case finding on them, or it might be that there's a hypertension or BMI. So there's a couple of reasons that are pre-set up there, or you can click on the other and type one in. But for now, I'll just choose hypertension and maybe current smoking status. And so they're my reasons for the indications for this review, and I press OK. And it takes me into the opportunistic case finding review. So you can see in here, it's similar to the CDM review form that you would be familiar with from before. So you can see you have all your sections down the side here. And the sections are in blue if they're already filled in, or as you complete them, they'll turn blue. They're red if there's fields waiting to be completed. And then at the bottom here, I have how many fields are left to fill in. So in my example here, I already had all the physical examination questions filled in. So I had done a consultation earlier on, and I just filled all this in to save time. So what it has done is, and just to say that if you have this physical examination information filled in the patient file in the last 15 days, it'll pull that information in for you. If it's more than 15 days, it will just pull the height, and everything else will have to be manually put in here. So just to be aware of that. So we'll move along. So again, the same as you could do for the chronic disease management, you can fill it in and you can scroll along here, or you can go through each of the sections on the side here to fill it in. So I'll start off filling it in. And again, like I said, you have the little red exclamation point indicating that this is a mandatory field that I haven't filled in yet. So I'll choose my drop down and I'll say never. And then vaping status, I'll put this in and I'll say never. Disease assessment, so it's looking for the Q-risk score here. So I click my little search and it will open up the Q-risk calculator. And you can see here, if I calculate, it's pulling all the information that I filled in previously, and any blood results, which we'll come to now, any labs that are in the file. It's taken all that information in and it will calculate the Q-risk. And you can see here, I've got my Q-risk score here. So the risk of having a heart attack, and this is my risk score. So I press OK here. And so I move through it. So you can see there, my physical examination is blue because I have all the fields filled in. My risk factors is now turned blue because I filled all this in. The disease assessment, the investigations, and now I'll move down to my OCF outcome. So at this point down here, this is the outcome of this opportunistic case finding. So when I click on the drop down here, my outcome may be normal. So I may fill all this in and realize that this patient is not at any risk. And if I was to choose normal there, I wouldn't be able to do another OCF on that patient for 5 years. The other option here is to register them to the prevention program. So if I click on this here, which I'll do because we'll move into the prevention program next, and it will ask me, why am I moving them? So what's the reason here? So I can say, you know, my Q risk 3 was greater than 20%, which it was up here, it's 24%. So I can say that's my reason that I'm putting them on a prevention planning. There's other options in there, hypertension, pre-diabetes, etc. So the other option in there as well would be diagnosed with a chronic disease. So I could take them directly from OCF. I could submit my OCF review and then take them into diagnosed with a chronic disease and fill in the chronic disease form at that point. So I would either submit it down here or I would save it here. Now, for you guys, like obviously I have all my labs already filled in here because, as I said, I filled it in earlier on. The labs will look back in the last 3 months and see if any of the results are there, and if they are, it will pull them in. But for you on this day, you may be just doing bloods on this day, so you may be, you know, taking the bloods. It may be kind of 2 parts to the one review, sort of. So you know, the patient come in, you'll take the bloods, and then when they come back in, you may submit it at that point. So if that is the case, you would just save it here, or you could submit directly from here. But for now, I'll just press save. And what has happened there is now that patient is now the opportunistic case finding has been completed, and they're now on the prevention program. So we'll save that. So we close out of that and we press OK and we say yes. And, you know, it may be a couple of days again before, or a couple of weeks before you do the next part of this visit, which may be the PP, or you may do it on the same day. I don't know how that will work for you, but we go into the PP here now. So we click on Glenda PP, this patient, and you will see in here that I already have my OCF filled in and I have everything done on this, and I'm going to do a PP for this patient. So I'm going to begin my consultation. And as I did before, I'm going to click on my Mediforms. I'm going to search for my CDM Mediform. So if I type in CDM here and I press OK, it will open it up. And you can see now the difference here is that I now have, instead of having OCF, I now have prevention program in here because I've already done the OCF for this patient. So it's assuming I either want to do a prevention program or a chronic disease. So in this case, we'll do a prevention program just so we can run through and show you how it looks. So we tick the box here, we press OK, and it opens up our prevention program review. So like the OCF, it's doing the same thing. It's pulling in my GMS number, patient's date of birth. I have the GMS checker here that I can check and see if the GMS number is valid for me. I can press OK. And the error code field I can type in, but it's not a mandatory field because it doesn't have the little red exclamation point beside it. So down here, I'll specify the reason. So the reason being why I'm doing the prevention program. Now, in the OCF, in the other patients, usually what will happen is I'm using 2 different patients here because I want to have them pre-set up beforehand. But usually when you do your OCF and you mark your reason at the end, you know, on the outcome part, when you put the reason in as Q risk greater than 20%, which we did, it will automatically carry that in here for you for the prevention planning. So this will automatically be ticked, and all you'll have to do is fill in the date. So we'll just say 2022 there, but because I used a different patient, it didn't pull it through there, but that's usually what will happen. So it will have the Q risk pre-ticked. And then if there is any additional reasons for you doing the PP at this point, you can tick them on here as well. So I will press OK here. And we're into our prevention, our PP program review. So again, very similar to our CDM or the OCF we were just in, we have all our sections down the left-hand side here. And as we fill them in, they will turn blue. Anything that's outstanding will be in red, and it will tell us under the warning here how many fields we have left to fill in. Again, we have our little GMS checker up here that we can click on and we can check and see is the number valid at this point. So here we have the physical examination. So as before, I have already filled this information in so that it automatically pulled it all in for me. But if for some reason I needed to fill that in, if this was blank, you can just type on it and type in your fields, and you can fill all that information in yourself. We go down to risk factors then, and so we have our BMI. If you see that little arrow when you click it, it takes you off to the website where you can look at information in there. And so we will tick on whatever, we're going to choose our options in here. So we're going to fill this form in as before, so like we did for CDM. So smoking status, and depending on what we fill in here, like if I say yes to that, it may cause additional questions to pop in. So like the CDM form, depending on what you fill in, you may get additional questions to answer. Vaping status, so I'll say never. Alcohol risk score, so the audit C score. So if I click on this here, so if I just say 2 per week, my audit C score is 3 at the moment. Now if I say 1 and I say never, once the audit C score is below 5, if I press OK, that's fine. But if I was to increase that and say 6, and I was to say 8 there, what happens is the audit C score is above 5. So what has happened is I have these additional questions that I must answer. So I would have to fill all this information in here. So you will come along and you'll fill all of these. And once we have them all in, we press OK, and our audit C score will be pulled in here. So physical activity, so we'll say 0 days, and we'll just fill yes. And then their Q risk score, again, we'll click the little question mark here, and it will take us in, and we'll calculate it, and it gives us our Q risk, and we press OK, and we move along. So our disease assessment has now gone blue. We're moving to our investigations. And has the patient ever had an ECG? No. If at this point I want to check the file at any point to see if there's something in there that I need to look at, if you press Control F or find at any point within your CDM review, at any prevention program, OCF or CDM, you get your Control F, you have your search function in here, so you could look for something in the chart there, and you could come back in and fill it in. So just to be aware of that. So I'll answer this question and I'll say no, and I'll fill this in. Thyroid function test, yes. Liver function test, yes. And anywhere you see these little icons, it will take you off to check these items and see if there's anything filled in here. So I could see the results for the TSH and the T4 and the T3 in there. The same way I could click for liver function, I can check that there as well. Press close, and now my investigations has gone blue, so I'll move to my patient education. So education provided by the PP or by the GP, yes. Agreed with the care plan, yes. Medication review, yes. And then it's looking to see who did the review, and I can click here to check the medication. I look at the medication, I'm happy with it, and I put my review date in there. Prevention program outcomes. So at this point here, again, this is the same kind of functionality as we saw in the OCF. So when I say prevention diagnosed with a chronic disease, if I was to say no here, I can then submit that, and then we could do another PP review on this patient within a year. You can submit one after 9 months, actually. So if I was to say no there, I could be monitoring this patient under the prevention program and doing a visit once a year for them. But in this example here, we'll say yes. And again, it will look for the diagnosed with chronic disease. So it's looking for the chronic disease that the patient has. And if I tick on, say, diabetes and heart failure, when I press save on this and I open up the chronic disease management form, Mediform for this patient, it will automatically have ticked those 2 conditions in there. So I'll just leave on diabetes type 2, and I would normally press submit at this point if I had everything filled in. But again, similar to like what I said earlier on, it might be that you've taken bloods and you're doing this in this visit in 2 pieces. So it may be that you're not submitting today, you're saving and waiting for the bloods to come back in. So we'll press save here. If at any point I need to get back into this form, I need to check anything in it, I just double click on any of the items in here and the form will open back up, and I could press submit at that point as well. I'm missing one field, agreed with the care plan. So I scroll down and we just put a yes in there and we'll submit it. And you can see now it's exporting, and I'm in a test system here, so this may not or may submit, I'm not sure. It did actually, it's sent there. So you can see that I got my success message there, and I press close here. So that's my PP filled in. So the next part then is the chronic disease management. So if we just, I'll open up another patient that I have a CDM on, ready to go. So the same, again, the same thing, I begin my transaction. Begin a consultation and press my Mediforms, search for my CDM Mediform, press OK, and I'm straight into my chronic disease management here. And this patient is diagnosed with the diabetes type 2, so it's open directly of my chronic disease management program here. The review date, their ethnicity is white Irish, and it's pulled all this in from the PP before that I've already filled in. It's automatically chosen the diabetes type 2 and the date. And this part here, other major diagnosis, there is a couple of new ones in here. I think the inflammatory arthritis and maybe the hypertension. There's a couple of new ones there that you can fill in and the dates on it. But for now, we'll just press OK. That's our registration screen filled in. And we press OK. And the next part you're probably very familiar with. There's a couple of new fields in it. But again, we have our CDM review form. So if we were doing this as a telephone review, I would tick that box on there. It's automatically pulled in my GMS doctor, my GMS number, and my IMC number. I can do my little check here and check and make sure everything is valid. The physical examination, it has automatically pulled in. As I said before, if it's 15 days, it's going to pull it in. If anything more than that, you're going to have to fill this in again. Diabetes related amputation, I would say no. And present, I'll just fill in this CDM form just so you can see how it looks. There isn't a lot of there's a couple of new fields in it, but not a lot. That was different to when before. Let's say no. Let's say no to that. We move into the risk factors. And so we'll tick this. Patient decline, smoking status, we'll say never. Vaping status, that's a new field there, I think. And we'll put in our vaping status as never. Alcohol risk, again, we have our Audit C score, so we'll click on this. So we'll say 3 per week, and standard drinks, say 5, and we have an Audit C score. If I change that actually before, so I don't have to fill all that in, and I press OK, oh, and never. And so I have my Audit C score now. Physical activity in a typical week, so we'll say enable. Vaccines then, so there is the COVID vaccine that's new in here as well. So we have the influenza vaccine, so we'll look to see has an influenza vaccine been given in the last 12 months, and if it has, it will automatically pull it in there. Let's just say yes, and the date of the vaccine, so we'll just put any information in there. I could look at my vaccine history by clicking on this icon here, and it will take me into the vaccine history. Or I can do my Control F at that point as well, and I can search the chart then if you were recording vaccines in any other way. So I fill that in, and then the COVID vaccine, I will say yes, and the COVID is their vaccine status up to date, and I'll say yes there. So my risk factors has gone blue, and I'll move on to my disease assessment. So my QRIST score, calculate, and I'll press OK. My investigations, has the patient ever had an ECG? And I'll say yes, and then the result. And then the lab investigations, as I said, I already had these filled in, and if you have done bloods in the last 3 months, they'll pull in here. If not, you can physically, manually type them in here. We have our thyroid function test, so we'll say no to that. Again, like I said, you can click on these little icons and that will take you in to check and see the TSH levels, and click here, check that, and I'll say no. Medication review, yes, and it's automatically pull that in because I had it done in the prevention planning. Education provided by GP, yes. Referred to education program, yes. Agreed with the care plan, yes. And then I'll just put details referred previously. So I can see here now all my fields have gone blue. I've no missing data. I could do the care plan at this point, but like before, the care plan is not a mandatory. You don't have to fill it in. And we'll save that review. So we filled in our care plan as well, just to show you how it looks. So I'll press save. So that's my chronic disease review gone into the system there now. And like before, if I need to get back in and look at anything in this or change anything, I can double click on it. I can edit it before I've submitted it. Once I've submitted it, I can change it then after that. So I have all my information and I can save it there. So the next thing we look at will be the dashboard. So the dashboard is similar to how it was before. So if we go to analysis and we go down to our chronic disease management dashboard, and we open up the dashboard, and you can see it's refreshing there. It's pulling in all the acknowledgements, etc. in there. So we have our date range up here, so we can tick it on and we can put in the date range if we want to look at a particular date. And we could click the little icon here to say, just show me the previous week or the current month or whatever date range you want to look at. This part is new here. So obviously if you want to just see your OCFs, you will tick that on. If you just want to see your PPs, you will tick that on, or just your CDMs, or you could do a combination if you want to see them. The responsible GP, doctor in charge, patient name, disease. So there's a couple of different fields in there that you can filter on. Patient age. The submit status may be the next one that you'll be looking at in here. So incomplete, not submitted, sent, accepted, rejected, and clinical rejection. So they're all your different statuses. So just to go down here, and again, you're very familiar with the dashboard. I'm sure green is anything that has been accepted. This kind of beigey color is anything not submitted. And then this is errors here. So hopefully you won't see too much of that. As I said, I'm in a test system here, so there may be things that I see here that you won't see on your system. So if we highlight one of these and we right click on it, we get some options here. So things we can do here, we can check the GMS number to see, check it online to see is it valid. So maybe, you know, before we submit it, we want to check and make sure it's correct. If we right click again, we can submit from here. We can open the chronic disease management form. So that will take us back into the actual form to look at that. We can open the patient file to look at the patient file. We can copy the GMS number to a clipboard. So maybe if we wanted to go off and check something on the PCRS website, we could copy the number, the GMS number, and go off and check from there. Export info or F3 gives us all the downloaded information, same as before. If you just press F3, you'll see all your export data there. Right click again. You have deregistration from CDM. This is new. I know a lot of people were looking for this before. So if the patient is deceased and they're no longer part of the program and you want to take them off this list here, you can deregister them from CDM using that link there. Download acknowledgement from Health Link. So we want to download the acknowledgement to see, you know, it's accepted there. I can see that there. That just refreshes that download, and refresh just refreshes. So there are all my different statuses within the dashboard. The other thing I have down here is this last visits tab down here in the bottom left-hand corner beside dashboard. I have last visits. And when I click on that there, I can see all my patients here. But I suppose the useful part of this is to look at my overdue visits. So I can see anybody who's overdue their next visit or who's due a visit in the future. And you can sort them. So if I was to look at my overdue, I'll see anyone in red here who's overdue their visit here. And you can see the date they had their visit on and the date they were due their next visit. And you can click on that and sort it in order as well, like you can in Excel. You could also look at your future visits from here. So when people are due in the future, so when they're in. So you could click again on due date, sort them in order here, and then you might export them to Excel and you might contact them that way. So it's a really useful tab there that allows you to kind of track when your patients are due back in for their next visit. And I think that's everything in CDM. If anybody has any questions or would like any further information on anything, you can contact me on my email address, glenda.o'neill@clanwilliamhealth.com, or you can contact the support desk on 014633098, and they'd be happy to answer any questions you have. Thank you for watching.